for the staff at Activate Healthcare.
Okay, so first we're going to be talking about primary care physician.
Yes, we are.
What is your name?
My name is Trish. I'm a physician assistant with Activate Healthcare.
Okay. All right, let's talk about the primary care physician job description.
Right.
What are the responsibilities of the primary care physician?
The responsibilities of the primary care physician include providing total health care management for all the employees and the dependents of the employer groups.
Okay, and what's important for this role?
You know, it's really important for the physician to understand the company culture, the work environment, the job demands, and to work collaboratively with the team members to make sure they meet the needs of the organization while supporting the overall care goals.
Okay. Now there's some key commitments that a physician has to have at Activate Healthcare. What are some of those key commitments?
Yeah, that's a really good question. One is to understand the patient first by listening to them looking at them as a total person, understanding their health risks, their goals and objectives, and then working collaboratively with the health coach and patient to engage the patient in improving their health.
That health coach is really key, isn't it?
It is.
Yeah,
it
the
is.
relationship
Yes.
with the health coach.
Yes, it
okay.
is.
So I understand there's some key responsibilities that you've outlined for the primary care physician, and let's talk about the first one. I understand the first one is strategic healthcare planning and alignment.
Yes. So to explain that a little more, providing primary care and oversight for the employer-based population by reviewing all the health risk factors gained through a health risk assessment, physical, and evaluation.
So what are examples of some of the health risk factors, just as an example?
Some of the health risk factors including smoking, tobacco use, being overweight, not exercising, not taking your medications.
Okay, great. And the second responsibility is healthcare delivery, the actual delivery of healthcare. Can you walk us through some of those responsibilities?
Yes. Conducting the annual health physical and health risk assessment on all employees and their adult dependents.
Okay, because nothing really can happen from the standpoint of managing their health unless you have that assessment.
Right, right. Yes, it's very important to have the yearly screening. That's when we can really get people engaged and find out more about their health and lead them down the right path.
Okay.
Developing with health coach and the patient, so working together with the health coach and the patient to develop tailored action plans so that they can improve their health.
Okay, because that's really the key differentiator of Activate as opposed to just going to a regular primary care physician at a regular doctor's office, right?
Right, right. Having that extra step, yes.
Okay.
Understanding and implementing the medical protocols and clinical standards specifically for the care provided in the clinic and disease management.
Okay.
Developing relationships with the community of providers in order to oversee all the clinical health needs of the eligible members.
Okay.
And also overseeing clinical delivery of all care and treatment of all the employees and dependents and case management for care received outside of the clinic.
So they're really coordinating the care from outside the clinic as well, so they can be the medical home, and they can be that the primary care physician can serve as their primary care physician, replacing a primary care physician on the outside.
Correct. Yes,
okay.
That is true.
What else?
Yes. The physician will also attend to acute visits, occupational injuries if indicated at that clinic.
Okay, so sometimes it'll act as an OC Health clinic.
Sometimes,
so
yes.
if someone steps on a nail when they're walking in the
right.
shop, they can go there and get OC Health.
Right. It depending on the way that the contract is set up. Yes. Yes. And also new employee physicals, possibly any type of drug screens, any other needs that the employer group requires.
So new employee physicals as opposed to, those are more like new hire qualification physicals.
Correct.
Like, can you lift this box
Correct.
if you're going to work in the warehouse?
Yes, correct.
Okay.
Yes,
Great.
yes. Utilizing technology to ensure efficient management of patients.
Okay, and we use a fair amount of technology, and I think there's going to be more and more.
We do. Several systems to learn, but it's very beneficial for the providers and the patients.
Okay.
Recommending changes in clinical areas or any general areas to improve the patient health and wellness and the delivery of care provided in the clinic.
Okay.
And managing chronic diseases such as diabetes, hypertension, using our highly interactive type of care to facilitate changes in successful patient outcomes.
And again, that could be a little bit different from what they would receive care-wise from the outside, because Activate is actively trying to manage some of these disease conditions, making sure they take their meds,
Yes.
making sure if they say, hey, I have diabetes and I'm traveling next week, what do I do when I'm in the airport to get food?
Right.
As far as having healthy diet.
Exactly, yes.
Great. Okay, what else have you got?
So the physician also supports patients in changing their health-related behaviors.
Okay, and that is key.
That is very key, yes. So serving as an educational provider for not only the patient, but also for the clinical support staff.
Okay.
So helping to support and educate the medical assistants, nurse practitioner, physician assistants, so we're all working together as a team from the same knowledge base.
And really the Activate philosophy is behavior is so key to
Yes.
managing health. If
Yes.
you think about, say, smoking, or someone who is sedentary that needs to be working out more or having a better diet, behavior is really, and controllable parts of elements of their health is really, really impactful.
Yes, it is. It is. Another thing they would do is establishing the goals for each patient to be
Okay.
monitored and tracked by the additional support staff in the clinic.
Okay.
And just like you said, supporting patients in their health, changing their health-related behaviors.
Mhm.
Also, there might be an opportunity, or there should be opportunities to participate in patient education sessions. We try to target certain patient populations at the different employer groups, such as a population with a high metabolic syndrome, incidence of high metabolic syndrome,
Okay.
so that the physician would present and help educate that population as a whole.
And that is something often doctors really don't have a chance to do in a regular
Right.
health practice, and a lot of feedback that we get from doctors say that that's one of the funnest parts of the job.
Yes, definitely. You have a contained population that you can really speak to and impact. Yes.
How about travel? Do they have to travel at all?
Depending on the clinic, there may be some travel if they're off-site locations, so
Okay.
that is clinic specific.
So, for example, they may have salespeople around the state in other small auxiliary offices.
Yes, correct.
And they can go down there instead of making somebody drive all the way to Indianapolis.
Correct,
Because that would
correct.
probably increase participation if we were more proactive.
Yes, definitely.
Okay. So what are some of the required qualifications for a primary care physician?
So the required qualifications include being board certified in either internal medicine or family medicine, and having a valid and current Indiana license. Committing to work collaboratively with a patient to improve their health, and also to work collaboratively with the Activate Healthcare staff.
So kind of buying into the Activate mission and the
Yes.
Activate clinical model.
Yes, it definitely, yes. Committing to continuously improve the health and wellness of each employee.
Okay.
Good leadership and communication skills. Experience with an electronic medical record.
Okay.
Because like you alluded to earlier, we have a lot of technological systems that we use. A sense of collaboration and cooperation with a willingness to continually learn. One of the things with the behavior change models is there is a lot of learning and practice involved in really honing those skills. So the desire to continue to learn about that and to continue practice and improve those skills is necessary. And ability to work collaboratively within the organizational culture and create a sense of teamwork with all clinical members and the employer to promote a culture of health and well-being.
Okay, that was a great summary. You want to wrap it up for us?
Sure.
And just kind of conclude us?
Sure, so we expect at Activate Healthcare our professionals to be industry experts and have a passion for focusing on the patient by designing and delivering healthcare services that promote health and wellness. We also encourage behavioral health counseling to improve health conditions and to promote a culture of creating an environment of healthier employees and families.
Okay, great job. Thanks very much. See you next time.
Okay, thank you.